More on the second anniversary of the pandemic. Dr. Kate Tulenko joins me now from outside Washington, D.C. She's the founder and CEO of Corvus Health. Always great to see you, Kate.
Pleasure.
Well, we've heard from richer nations, no one is safe until everyone is safe. But 2 years on and 6 million deaths later, how would you assess where the world stands right now when it comes to the pandemic?
Well, I think there are two main risks or two big challenges. One is that there still is a possibility that another variant can emerge, another Omicron and another Delta, and that we can go through all this again. The other big challenge is that we're going to have long COVID, for the next 50, 60 years. The journal Nature published a study just yesterday showing that people who had even mild cases of COVID showed pretty significant changes in their brain, loss of gray matter, premature aging of the brain. And so this is really going to affect our economies and our cultures in ways that really is not yet clear.
I want to piggyback off that because the CDC here in the United States recently brought up the possibility that COVID could become a seasonal illness. What do you make of that?
I think most people think that's the case, that COVID is now becoming endemic, much like the flu. And like the flu, it will change every year. So we'll have to get a different vaccine every year. That definitely is the case. Also, I think as far as where we are with COVID, I think on the positive aspect, we've had revolutions in vaccine development. We've had revolutions in telehealth and long distance education. But also on the negative side, apart, of course, from the 6 million deaths and 500 million cases, we've really had a consolidation of the anti-vax community and a consolidation of science skepticism worldwide. And this is going to make it very difficult moving forward. In fact, I think if we have another type of outbreak, another type of pandemic, it will be extremely difficult for most countries to impose lockdowns. I think it would be very difficult for the U.S. to have the type of lockdowns that we did the first few months of COVID.
Well, right now we are seeing surges in China and other parts of Asia. Hong Kong's cases are the highest they've ever been. Other parts of China, what is happening? Is it because there's less natural immunity or not enough people vaccinated? And how does the zero COVID policy play into all of that?
Well, Hong Kong is a very special case. Hong Kong did have a zero COVID policy, much like mainland China, and they were very successful during most of the COVID pandemic, and only had double-digit numbers and very low numbers at that. But what happened is when vaccination started, there was publication of maybe some negative reactions or some older people passing away after they received the vaccine, and as a result, many older people in China refused the vaccine, so they have very low rates of vaccination amongst their elders. And now that Omicron has entered Hong Kong, it's really just spreading through their senior homes, and that's why they're having the highest COVID mortality rate in the world.
Kate, about 45 seconds left, but quickly, any improvement on the challenges of vaccine hesitancy in many parts of the world and the issues around intellectual property with some of the drug makers?
I think with intellectual property, we have seen actually the starting of many new vaccine companies that will have a different take on intellectual property and be more willing to share it. So I think that's a positive move. We haven't seen, companies, forcing the patents and using them. That hasn't happened. And from the point of view of vaccine hesitancy, I think we will have to redouble efforts of education, both in public schools and also with the wider public, to start to chip away at that.